Muted.
Hello, everyone, and good afternoon and good morning to the West Coast. Thank you so much for joining us today in our Child Care and Development Block Grant webinar series on highlighting the new opportunities for consumer education. We're having some sound difficulties, so let me make sure that everyone can hear me. Ann, just because we have you unmuted, can you hear me okay?
No, she's on mute.
Okay, Jen, are you able to hear me all right? One more sound check.
Hi, Michelle, I can hear you.
Okay, awesome. We're ready to go. I got some comments that I wasn't being heard. Okay, so I think we are all set. Thanks all again so much for joining us this afternoon and morning for those on the West Coast in our Child Care and Development Block Grant Implementation Station webinar series. Today we're going to be discussing highlighting the new opportunities for consumer education within the Child Care and Development Block Grant law. We have some incredible folks on the phone today, as you may have heard them in our sound check, a little preview of their voices. What we will be doing today, and I'll give a walkthrough of the agenda here. Welcome and introductions. I will then pass it over to our Director of Federal Policy and Governmental Affairs, Jay Nichols, who will give an overview of the CCDBG 2014 law and the requirements of consumer education in the law. We are introducing Jen Bump, who is now on board with Child Care Aware of America as our Senior Director of Practice Innovation on her inaugural webinar with Child Care Aware of America today to talk about opportunities within the consumer education pieces of the law. And then we will take it local and bring it to Minnesota, where the Executive Director of Child Care Aware of Minnesota and also our public policy chair of our committee, Ann McCully, is joining us and talking about the great work that Minnesota is doing around consumer education. So this topic is very relevant to me right now and personal, as my 2.5-year-old and my infant started in their new child care classrooms. You can see those little guys on your right in the picture. And, you know, child care is one of the most important decisions that parents have to make in their lifetime. And why this issue is incredibly important to our organization and to the folks I know on this call, so thank you for taking and carving out the time to be with us today, is that families need high-quality, affordable child care so that they can balance the demands of family and work life and be successful as parents, as family members, and as workers. And child care consumer education provides parents with the information that they need to help assess what they're looking for and locate those critical services and evaluate the different elements of quality and ultimately choose the best possible care that meets their needs. So with that, we'll get started. I also wanted to provide another update that we are going to be doing things a little bit differently. We had some wonderful feedback and questions asked on our last webinar, so we wanted to ensure that we carved out enough time at the end of this session to allow for a little bit more question and answer, but also for some discussion. So what we will do is, if you will stick with us after the presentation, we'll have the opportunity for those on the phone to chat amongst yourselves and answer and ask each other questions and share best practices. And then please note at the bottom of the slide that the Department of Health and Human Services, HHS, is charged with providing guidelines for CCDBG implementation. And the intent of these webinars is to provide information and offer forums for discussion on these critical topics. So we will continue to post the updates from ACS and continue to share with their guidelines for CCDBG implementation as they come out. So right now, I will turn it over to Jay.
Well, thanks, Michelle, and hello, everyone on the phone. I'm just going to spend a few moments to kind of go through what the new CCDBG law requires around the issue of consumer education, and then I'm going to hand it off to Jen, where she could kind of go into discussing more what potential opportunities there are under this category. So as everyone is aware, last November, CCDBG was reauthorized and signed into law. First time since 1996 that this law was, was reauthorized, and prior to, with the authorization of a number of new items under this new law, prior to the 2014 law, there have been states, or some states did actually on their own go ahead and provide consumer education information, although it wasn't required under federal law. Now, under this new law, it is required, and obviously for very good reason. So what I'm going to do is just spend a few moments to just go through under, as it's currently defined under the law, what states must do, and what they must do, and what they, and the minimums that they must at least include via public information. So in general, states are responsible with providing parents, caregivers, and just the general public with comprehensive information on the wide range of child care options, including information about about the quality of CCDBG providers. They also must provide information on research and best practices concerning children's development, including social and emotional development, early childhood development, parent and family engagement, as well as physical health and development, including physical activity. In addition, the availability of child care services provided through CCDF and other child care services, states, and this is actually very important, states must actually provide information on other state policies regarding social and emotional behavioral health of young children. It could include behavioral intervention and support models. It also, as well as policies on expulsion of pre-age children and in early childhood programs receiving CCDBG funds. States must also provide other financial assistance. That CCDBG families might be eligible for, including TANF, SNAP, the Women, Infant, Children's Program, Children's Health Insurance Program, the Child and Adult Food Program. And lastly, and I just wanted to highlight this, that they also must provide information on screenings. They must provide, and that information must include how parents can obtain a screening for their child if they want one. States must publicize, they must publish the resources and services so that will help provide access to screenings and referrals. Including coordinated use of early and periodic screening, diagnosis, and treatment through Medicaid and developmental screening under the Individual with Disabilities Act, as well as particularly Part C when it deals with infants and families. So that's really what overall that's what the consumer education information must include. Just digging just a little bit further into what also must be included. Just want to highlight that what you see on your screen here. In addition to that, states must make available the results of monitoring and inspection reports for both licensed and license-exempt providers that receive CCDBG funds. This goes into effect 2 years from now, particularly November 2017. In addition, there also must be, it's required of a national toll-free hotline, be established by and operated by the Department of Health and Human Services. As maybe we've heard many times before, it will be available 24 hours a day. It has to provide the widest possible access to services to families. It must be dual language, or other languages other than English. And in addition to the toll-free hotline, it also must include a website that could provide a link to information on CCDBG eligible child care providers, as well as other items. And lastly, under new consumer education requirements, as it particularly relates to the new national hotline, parents not only will be able to, but under the law they must be allowed, if they want to ever report a violation of any kind for a CCDBG provider, whether it be related to neglect or abuse or violations of health and safety, they should be able to report this anonymously, and which obviously I know is very, very important to a number of parents. When we're dealing with the issue of safety for children in these settings. So that's in summary, that's what the new law requires. Just moving forward, as always, when we do these webinars, I like to remind everyone on the phone, March 1st is not that far away. And many of you are aware, and I think many of you did actually submit comments, but ACF did recently open and close their comment period that ended late last month. We are actually hearing, although it's not official, but we do anticipate that the additional regulations that ACF had said, earlier this year that they intend to publish, or when they spoke to us in March, they were actually in the process of writing them, but we are now hearing that they are likely going to be published later this year, and we're thinking heard around either early to mid-November. Could be sooner and it could be later, but the one thing we know for certain is that they will be published before the end of 2015. So we will obviously keep an eye out for that, and the second that we receive word that they will be published or are published, we will be sure to share it with all of you. So that is it for me. I would actually like to now turn it over to Jen, and bear with me for 1 second while I get Jen. All right, Jen, you there?
Hi, Jay, I'm here.
All right, great. So, please feel free to take it from here, and when you want, if you could just do me a favor, when you want me to change the screen, if you could just indicate, and I'll do it for you.
Okay. All great. Right. Well, thanks a lot, Jay. Just want to start out and let you know, as Michelle said, I'm new to Child Care Aware of America, but have extensive experience in consumer ed best practices over the years, as well as working in the Indiana State Network for the last 7 years. And so I'm It's important that we always begin with the CCDBG goals and intentions at the forefront of our minds. The first goal you see here, increasing access to high-quality care for low-income families. This is not a new focus for the Office of Child Care. This is one that we've been working on for some time now. But I think it's always important to pull that out, to really understand that there's an emphasis on access to high-quality care, and we have a specific target population, as well as other vulnerable populations. You'll also notice as you read CCDBG that there is a focus on transparency of information about child care choices, as well as a specific focus on increasing the aspects of our services that are family friendly. So ensuring our policies, our practices, our programming are developed with the sense of being family friendly. So as you take time to work in your state, take a good amount of time to reflect on what it means to be family friendly and what that experience would look like to a consumer, and that includes a focus on transparency and the information about regulations and health and safety and processes that occur in your state. Okay, Jay? Okay. Again, some of what I'm going to share to you might be a new concept, but having been in the field for a long time, I know that some of these concepts are ones that maybe you've already considered, ones that you've already implemented, and I think Ann from Minnesota is a great example of that. I know there are a lot of other great states and local CCRNRs that are implementing some of these practices already. Also, you know, as we recognize the work, that the work of creating state plans has already started. This has been underway for some time now. You yourselves have a lot to share about the effective and innovative practices that are developing in your states, and I hope that you'll share those at the end of the call. So as we get to the end of our presentation, please be sure to not only ask questions, but bring together for the rest of us your innovative practices. As you know, all of you know, I think in CCRNR, you need to leverage your relationships, and relationships are everything. As I came from the Indiana State Network, the relationship there between the state administrator's office, the local CCRNRs, and the state network was very strong. In this situation, you have a lot of capability to contribute new ideas for consumer education in the state plan. And again, just recognizing that relationships are so important, that your ability to influence and inform the activities in the state plan really has to do with your ability to really connect with your state administrator's office. So lean on the relationships that you have. Build them where you don't have them. Make sure that what your capabilities are known to your state administrator's office. As you bring those ideas and solutions to the forefront, I think it's really important as a system, CCRNR system, that we really convene within our state, with our fellow CCRNRs, to present a unified approach that can be applied statewide, but that's also community focused. I know, having been in Indiana, sometimes this is harder. It's easier said than done, but I think it'll be so important for you to coordinate your efforts as a CCRNR system as you bring them together for your state administrator for consideration. CCDBG calls for more comprehensive family support services, so that includes WIC, TNF, etc. This is a great opportunity for you as CCRNRs. One of the things we know you do well is you work within your community very, very well. You have an opportunity right now to communicate with those partners, to let them know, you know, what's coming with CCDBG, to let them know about your desire to collaborate. One practice that you can use to formalize that collaboration is to develop MOUs that explicitly state what your relationship will be like and what the expectations will be for either side of that relationship. Finally, you know, recognize that while many states have been engaged in consumer education to help inform families of their options and to promote parent choice for a long time, there are staff out there, frontline staff, who have great ideas about how to do our work better, how to do it more effectively, how to be more family friendly, how to be more transparent. So, you know, I consider those folks part of the solution. They're knowledgeable, so the recommendation here would be to engage them as much as possible, ensure that they're knowledgeable about the requirements of CCDBG, knowledgeable about their role in the process, as well as knowledgeable about the state plan process. Sometimes we know frontline staff, they may not get everything that leaders might get in their organizations, but offer them an opportunity to engage in your program development for families. Okay, Jay? Okay, so some of these, again, these are some ideas focused on how to increase access to high-quality care for families with low incomes. These are some concepts you've heard before. Some of them may be new, but they're definitely worth coming back to. The first is in a centralized statewide consumer education hotline. This is a wonderful way to demonstrate that the CCR nurse system has the infrastructure to deliver consumer education in a streamlined fashion. Next, as you look at that model, and Ann, I believe, can talk about that as well, what they've done in Minnesota recently, you might have an opportunity to reconsider the roles at the local level. So if you have local CCRNRs, consider how you can reinvest the time of the staff who may have been working on hotlines locally, and that could look like face-to-face outreach and referrals to targeted populations, and that might be right at the CCDF office if you're not a CCDF administrative office. It could mean face-to-face at TANF offices with clients there. So think about how you can get out, you can get in the community, and make those connections locally. Next, I think many of you know this, it really is an opportunity to embed your quality rating and improvement system in all the touch points for families. That goes from the beginning to the end of the spectrum. And one way that we've seen some success in Indiana, I'm sure again you all have great ideas, but when there's communication with folks who are waiting for CCDF vouchers, that's a great opportunity to ensure that you can reach out to them. You can provide information about the QRIS and ensure that they're ready to make a choice of a high-quality program. You also have some opportunities to think about how you distribute referrals to families. This is it's a little bit more outside the box thinking. I'm not sure how many states have adopted this strategy, but you do have the capability to develop and implement policies that will prioritize your QRIS or your highest quality providers in your referrals to families. Again, especially with families who are receiving CCDF vouchers, you have the capability in hackerware to configure your system so that families searching for care will see the highest rated programs first. I think that's an easy thing that you can do if you haven't done that already, and will certainly lead to more access to those high quality programs. You have a great opportunity with data sharing, and I could talk about data sharing for many, many hours, but just for the sake of consumer education, work with your state administrator's office. You can, with a little bit of effort, put practices in place to make direct connections with families who are applying for CCDF vouchers, and that might go so far as to receiving listings of CCDF families or families who are on CCDF wait lists, receiving their mailing address, and perhaps disseminating referrals to high quality programs to those families without actually even waiting for those families to contact you. You can implement ongoing parent engagement strategies. I think my partner Kim Engelman spoke about some of those parent engagement strategies on her webinar. Some of the ways that you can accomplish this targeted outreach and really focused referral is through the old enhanced referral process. So if you think about populations that are considered high priority, think about how you can deliver referrals in an enhanced manner to those folks. From a parent engagement, again, for the new program you might have heard about, Broom, that's coming out. It's ways that you can engage families with their children in everyday circumstances. I hope you'll look for some more information about that coming out from CCA. Next slide, Jen. Okay, so if you've, I know our email boxes are always full. in the last couple of years, you may have seen an email about giving information about the BIAS project, so Behavioral Innovations to Advance Self-Sufficiency. This is a project funded by the Administration for Children and Families. The project really aims to incorporate behavioral economics principles into social service programs with the whole goal of increasing outcomes for those families. There was a project recently in Indiana with CCDF families. There was a project where consumer education materials were updated. And the whole idea is that you can make small changes, changes that are not costly in your materials, in your approach, in your work with families. And those small changes will have a large impact on achieving your goals. So I've included a link here on the site. You can go to that ACF page and read a little bit about it. Again, it stretches from child care to, I think there was a project for the domestic violence hotline. Take a look at those and see if there's anything that you can incorporate into your consumer ed activities. Next, I always have to touch on this. Really, as we want to increase family access to high quality care, it's so important that we actually know where the gaps are between the availability of that high quality care and the demand for high quality care. I stole this slide from my colleagues and good friends and family at the Indiana State Network to give you an example of how you can use data to really see where there is high quality care. And you'll see on this map there's some boxes that represent the highest rated paths to quality. That's the QRIS program in this particular county. And you'll see that there are some different colors. The colors represent concentrations of CCDF children in that particular county. Those are children who are using CCDF vouchers. And this was done with a combination of NACRAWare data and data from the state administrator's office, including the addresses of CCDF children who are using CCDF vouchers. So again, why do you want to do this? You want to be able to be really laser focused on your efforts to increase the availability of that high quality care where it's most needed. Next slide, Jay. Okay, so Jay talked, he did a great job of explaining the requirements for the national toll-free hotline and website. And I just wanted to take a moment here, especially as we think about new opportunities, to kind of touch on this point and to think about what the CCR in our system would need to do to be poised to play a role in the design and implementation of the hotline and the website. And you'll see that the website here will be a .gov website, so it's a government product. You all know that as a CCR&R, you are the primary source of comprehensive, up-to-date data on child care facilities in the nation. You have the most data, you keep it up to date. As a system, we really need to embrace this as part of our value proposition. So it doesn't matter what state we're in. I think if we are to think about what we can contribute to this part of the law, we will be in good shape. So you can prepare in your CCR&R and your state system for data sharing. Ensure that your data is up to date, ensure it's accurate, ensure it's consistent throughout your state. And that might mean, you know, if you have several databases, referral databases in your state, you might want to engage in, you know, looking at your definitions, looking at your fields, ensuring that they align correctly. You may want to think about going to a statewide database, maybe if you haven't done that already. This is something I have a good deal of experience with, and we'll be happy to lend a hand to you if you want to have a conversation about that as well. And then finally, Jay did talk about part of the law that includes handling complaints through the hotline specifically with child abuse and neglect. Within your own state, you very likely have a CCR policy procedure for handling these types of complaints. This is a good time to evaluate your own policies, make sure that they're strong, make sure that they're effective, they're coordinated with your state administrator and other offices at the state level. It's very, very likely that you'll be part of that conversation around you know, how do you do this in your states? How do we make sure that we have a family-friendly process and that all of those pieces are indeed transparent? Okay, next slide, Jay. Finally, and I'm excited to turn it over for Ann. For her example, I just wanted to touch a little bit about this whole concept of being transparent. As you work in your state, know that your state administrator's office has some requirements around putting out descriptions of the process for licensing, the process or the differences between child care programs. Make sure that your information is aligned with that language, and seek opportunities to be engaged in the evaluation, revision, and the development of those resources. Ensure that families have access to child care facility inspection information. Jay talked about this earlier. Now is the time, if you haven't already, to investigate what are the technological requirements and capabilities. What do you need to do to make this happen? If you're using NACRA data services, there are some new features there that can help you achieve this outcome. Of course, a great opportunity to have a conversation with your state administrator about how you can be a part of that solution. And then finally, as transparent information is being made available to clients with CCDF vouchers, think about what kind of information on child care providers would be useful. What would a child care quality scorecard look like in your state? Be part of that conversation with your state administrator's office. Start thinking about solutions now. I'm going to go ahead and turn it over to Ann, who's going to share some great examples from Minnesota.
Jen, thank you very much for that. That was fantastic. And before I hand it off to Ann, I just want to encourage folks that if you do have a question, please feel free to ask it in the, if you see on your screen, there is a dialogue box where you can type in your question, and we will do our best to get back to you in a timely fashion. So, okay, Ann, are you there? Sorry, folks, hold on for 1 second here. I think we may have lost Ann for a second. Be right back. Be back with you.
Okay, well, we're waiting for Ann. Oh, we got her back. Looks like.
Ann,
okay.
You there?
I'm trying both things.
Oh, okay, well, I think we got you back on, so bear with me for 1 second here, and when you're ready, please begin.
Okay. I'm not sure if I'm on the phone or on the computer. I'm trying both. Am I coming through okay?
Yes, you're coming through just fine. And also, if you want, please, when you want to change slides, if you could just let me know, so I can do that for you.
Okay. Sounds good. I've got a bit of an echo, but I'll work with it. So thank you. Good morning and good afternoon for everyone. Welcome from Minnesota, and also from the Board of Directors, and in my capacity as the Public Policy Chair I have told both Michelle and Jay that it was an interesting time to step in this fall as the chair to finish out Elizabeth Bonbright's term. Very exciting time to be involved in public policy, needless to say. So what you see in front of you are some information about how we have started the process, I would say, in Minnesota around dealing with the consumer education issue. We have had for about 8 years now, 4 years in a pilot form and 4 years just this year now rolling out statewide our quality rating improvement system, which is called Parent Aware. And so Parent Aware has become what we're now terming our entire parent-facing effort. And so you will see on the slide things like we have a 1-888 number that is a centralized call-in number for all of our statewide services related to parents. It actually serves for providers as well, but in this context it's for parents. We've also looked at the question of how do we promote our services to multiple languages, which I'll get into in a minute. We do have a language access line through our Child Care Aware system that handles Somali, Spanish, and Hmong languages. And then we have access to an additional language line through the Minnesota Department of Human Services that can go much deeper into other languages, and we are connected to that. And then finally, we've created a toolkit for parents, for consumers, that does touch on some of the requirements, and I'll get into what I think we are doing well and then areas where we still have some growth when you look at the CCDBG regs. But the toolkit does try to outline best practices in early education, and that goes to all of our phone referral consumers, and increasingly those same articles are available on our website. So Jay, if you want to advance the slide. This is just a quick snapshot of 3 of the versions of what we call our tri-cut. This is our main promotional material for parents, and what you see there are Hmong, Somali, and Spanish language versions. What it says in English, for those of you who either can't see that or don't read those languages, is we help parents find the quality care and education their children need to succeed in school and life. We work side by side with families, offering free tools and resources to help them make informed choices about high-quality care and education opportunities. So that is our main promotional piece, and as you can see, it's in multiple languages. Next slide. This is a quick snapshot of the front and a couple of pages out of the toolkit I mentioned. And again, this is a fairly substantial toolkit that we've revised in the last year, again branded with Parent Aware. And some of the things that are in there that would reflect what's being required from CCDF is talks about ratios and group sizes in terms of educating parents. It talks about paying for care. There's a section on care for children with special needs, even touching also on transportation issues, and then also talking quite a bit about infant and toddler care. And then some of those elements, as I said, are also available on the web. What I don't feel like we've maybe connected as much with yet are the issues around health, nutrition, and physical health. But again, this will come up in a minute when I talk about some efforts around Help Me Grow. Next slide. Probably the biggest positioning we've done, though, to get ourselves prepared for what we knew was coming down the pike in terms of expectations around promoting quality and also promoting and connecting with licensing is our new website. And I can still call it new because it's just barely past a year. But this was a joint effort of our organization, an organization known as Parent Aware for School Readiness, or we call them PASSER, which is a business-led effort to promote and support the idea of the quality rating improvement system, and then the Departments of Human Services and Education. And PASSER actually are the ones that stepped up with funding over $200,000 just to get the website up and going, and then have continued to provide funds to do promotional campaigns through radio, through digital ads, through public television sponsorship, all kinds of targeted efforts. So the website is a blending of our old NACRAWare led website, so it still draws on the NACRAWare data. Jen mentioned that a few minutes ago, but it's also blended with the licensing database in Minnesota and our Department of Human Services database that gives us the Parent Aware ratings. Next slide. This is just a screenshot of the top front of the web page, and you can get a sense of how parents can search. So you can search by location or the name of a program that you might be interested in. You can put in your address, and then you can also sort by these types. So there's centers and preschools, there's family child care, and then there's Head Start and other, I think it's just Head Start, sorry. And you have a click there where you can look for more information about what each of those types of care mean. Next slide. And then once you've made your search, you can see here a couple of pages. The first page on the left shows you some additional ways once you've made an initial search that you can narrow that search. So you can say, I just want to see 3 and 4 star rated programs. I should stop and say, Jen mentioned this in her presentation, this does default to star ratings first. So 4 star, then 3 star, then 2 star, etc., and then even participating, and then the other category is not yet rated. There is a final category. We do have some programs who cannot be rated, for instance, school-age care only programs, and that will say they are not eligible for rating. So it defaults by rating, but you can narrow your search here by the ratings, the distance, and then you can see some of the hours of care, the schedule. What you can't see on there is that you can also look at ages, you can look at languages, you can search by things like environment, meaning is it pet-free or smoke-free, and then finally there is a way to search to make sure that these programs accept child care assistance, which is our version of the child care assistance program. On the right, you will then see in a further inset, if you were to click on the name of a provider, you will see an explanation of the rating program and a click through to more information. You'll see obviously the basics about when they're open and where they're located. You can view them on a map. But over there in the circle is the piece I would want to call your attention to. That is the link to the actual licensing lookup in Minnesota. And what we love about the new website that we didn't have the ability to do in the past is you can go straight to the record of that particular provider. We used to provide the licensing lookup link to parents, but you'd have to start all over again and look up the provider. So that licensing lookup, again, thinking about what's required in CCDF, we're much further down the road of where we need to be as a state with center-based programs that are licensed, because the state oversees those licensing regulations and has the staff to do it, and therefore has a lot better access to the records. And so you can even see on that licensing lookup examples of negative actions, of correction orders, of compliance reports, so you can really get a lot of in-depth information. We're not quite there yet with family child care because those are administered by the counties. And I was just in a call last week with the licensing division at the state where they were talking about how they're going to handle that and what options might be available to put at least some additional information up. You can go on and see if they're active. You can see the general information in terms of what they're licensed for, how many children, what kind of space, but there isn't the level of detail that you'll find yet anyway on centers. Next slide, please. Then this is just a few other examples of how the consumer education piece shows up on the website. Again, we try to make sure a lot of that material that's in the toolkit is also available here on the web. It might look a little different, but most of the information is there. So the first panel you can see gives you more information about the types of care in a state. How do you narrow down your search? What might be best for you? And then on the right, it starts getting a little bit more into what I would say are the importance of family involvement, and how they can be involved in reaching out and making visits. And in a minute we'll see a few other examples. Next slide. This is also an important piece, and you'll see that reflected over and over in the CCDF, and that is connecting with the issue of paying for childcare. So this is just an article that's on our website about how to think about paying for care. It has a link to a tool that we're very lucky to have in Minnesota through the Children's Defense Fund called Bridge to Benefits, which talks about not only paying for child care, but a wealth of other social service programs, including health care, including food program. So again, starting to create some of those linkages. Next slide. Here's the one I had meant to point out, and this is the Staying Involved checklist. This is where I think we are talking more about parent and family engagement. So feeling that you can make unexpected visits, knowing that you can take time when you're dropping off and picking up, some other tips here that go on about how to stay engaged and the importance of staying engaged as a family. And next slide. One other thing I wanted to point out is the CCDF preprint talks a lot about consumer ed, but it also leaves room for doing that, first of all, educating providers, but also using providers to educate parents. And I did want to call out the fact that in our quality rating improvement system, there is a section that deals with providers giving parents information about health, screening, social service materials, and getting points for that as part of their Parent Aware rating score. The other thing we've tried to do through our Parent Aware program is provide access for those providers with a couple of organizations, the Center for Inclusive Child Care, which is based out of Concordia College, which specializes in special needs children and helping providers understand how to support special needs children. And then there also was a reinvigorated, through our Race to the Top grant effort, to put more health consultants out in the field that can work with those rated programs around those issues as well as broader issues dealing with the health of children. Next slide. This is just a screenshot of one other tool that is primarily provided through the Child Care Assistance Program, but I wanted to put it in here simply because it does have a lot of those other linkages that are mentioned. It talks more about IDEA, other funding programs, early childhood screening, and school readiness. I think the thing that we are missing, and actually if you want to go to the next slide, Jay, this is actually my last slide. This is what I think about where we have yet to go. I would say some of those linkages, again, most specifically to the social service programs more broadly, is an area of improvement that I hope we will be focusing on. One thing our state has been doing, the governor has had a very strong interest and had a legislative initiative last year around moving forward with the National Help Me Grow model. And many of us in the child care aware system have been sitting at tables to look at the question of how do we build that model in Minnesota. For those of you who are familiar with it, I think it often does include a centralized phone line that deals with connecting parents, particularly to special needs, but also all kinds of other issues that are family supports. And so I think no matter what comes out of that planning effort, we will certainly be looking to connect with that, with our system. I would say the other couple of things that are mentioned in CCDF where I don't feel like we've necessarily had a lot of history is this piece around not only social and emotional behavioral health policies, but there's a specific call out of expulsion policies and sharing that information with consumers and providers. And so I think that will be an area of growth for us. Again, there's a lot of information about licensing right now connecting you to the results, but there isn't a lot of information about how does licensing work in the first place, and there is a mention of that in CCDF about sort of helping consumers and others understand what's licensing in the first place, how do programs get licensed, what does that mean, etc. And I think there'll be some work there. And then finally, there's a very specific call out of providing aggregate information on the number of deaths, serious injuries, and child abuse. And I think that is something we have not, at least traditionally, included in our consumer ed, but will be required to, and so we'll need to be looking at doing that as well. So that's really it for me. Again, I'll just wrap it up by saying, you know, we sort of saw this coming. We were lucky enough to have always had a quality rating and improvement system that used the name Parent Aware and had parents in the forefront. Also because we are a CCR&R and the idea of consumer ed has always been right at the heart of what we do, I think this has put us in a good place to both springboard and build on what we've always done. So that's what I have for you today.
And thank you very much for that. That was fantastic. I am actually about to hand it back over to my colleague Michelle. But before I do, just because some of you, I've received a few questions about this, just so everyone is aware, both the slides and a copy of this presentation, this webinar, will be on our website under our CCDBG page by the close of business today. So we will have that ready. We should have that, you know, within the next couple hours. We'll have that up and running. So, all right, I'm going to hand it back to Michelle, who's going to take it from here.
All right, everybody. Thank you so much. Huge thank you to our guest, presenter, Ann McCully from Child Care Aware of Minnesota, for that wonderful presentation and information as we're all thinking about what consumer education opportunities and challenges that we're looking at, and as we look at our state plans and the preprint. So thanks, Ann, and also thanks to Jay and Jen. So right now, as I mentioned on the onset of the call, I want to, for you all to have the opportunity to, one, see all of our contact information up on the screen if you have direct specific questions for any of the presenters today, but also have an opportunity. You have the ability to actually chat a question to the entire audience if you would like feedback from not only the policy team here at Child Care Aware of America, or Jen as the Senior Director of Practice Innovation, or Ann from her specific presentation in Minnesota, but for the audience in general. So why don't we, I'm opening it up right now. I do see that, Ann, you have a question specific to you, and why don't I read that question aloud and have you respond if possible. So the question is, did Minnesota create a more user-friendly interface for NACRAware? Is this available for other CCRNRs to have access to?
I did see that question pop up. Yes, what we did was contract again through the funds that we received from the PASSER, the Parent Aware for School Readiness organization. They worked with a technology firm to create a new interface, and so NACRAware kind of feeds in through the back, and as I mentioned, then it blends with the licensing data in Minnesota as well as the Department of Human Services data. You know, that would be a question I would need to take to them in terms of whether they'd ever be willing to, in a sense, sell that interface. Surprisingly, I don't think I've been asked that specifically, although I will say that it was so specifically tailored to meet the needs of our state and those unique databases that I don't know how applicable it would be to other states, but I'm willing to certainly check into that and get back an answer back perhaps to you, Michelle.
Absolutely, and then we can send it out to the group. Great. Okay, and this is why we love this chat function, is that Ohio created an interface with NACRAware working with Qualistar in Colorado, and they provided the link. So thank you so much, Todd, for that. Okay, so continue. If anyone else has questions, please feel free to chat them. Okay, anything else? I'm not seeing any other questions, so here's another one. How do you capture statistics on the users for the interface? So another question and Todd, we have the ability to unmute you if you have a response to that, or if Ann, if you have any anything you wanted to add. And Todd, you are unmuted if you would like to respond, and also Ann, you are as well.
Okay, well, this is Todd. Can you hear me?
Yes, we can.
Yeah. So what's nice is the tool we build off of with Qualistar in Colorado, it has some standard reporting that gives you a lot of that information. Now, you had to go away from, because we didn't want to hold folks up in the processes, and this is one of the lessons learned from Colorado and their work, by having folks to have to sign up for something to get through the search. So you lost some of that information, but you still are able to track a lot of it through the reports that are part of it.
Right, and Todd, this is Ann. I will piggyback on that and say we can do things like page views and number of visits and number of visitors, all of these other statistics. But just like you, we decided we didn't want to require people to sign up in order to use the tool. And so we are already in our own discussions about how to track that.
And we have seen a huge increase. Now, Colorado, they said that when they first put the tool in place, they saw a 60% increase in converting to finding care over like a 3-month period, and we've seen the same or even higher increase since we put the tool in place.
Absolutely. I would say the same thing. I skipped over that, but our page views, for instance, have grown about 5 times from what they were, from 95,000 to about 440,000. And we've gone from the number of what are called sessions from about 4,000 a month back in 2013 to an average of 15 to 18,000 per month in the last 6 months.
And this also, for everyone, this also made us go through a scrub to get all our NACRAWare data cleaned up. So we've seen a lot more accuracy and consistency across the state just by putting that effort into play.
Great, and there's a request, Todd, for your contact information. So I'm happy to put that up here
Sure.
on the screen if that's okay with you.
That'd be fine.
Okay, fantastic. And then, Ann, the next question was to you, and I think we only have time for one more question, unfortunately, but we will definitely, again, have all of our contact information on the screen or in the chat box. And it's about parent aware. Is it a term and visual similar branding as Child Care Aware? I'm guessing Child Care Aware of America.
Yes, we use Child Care Aware of Minnesota as our overall agency brand and just about everything we do, but we've chosen to brand what we give to parents as well as the rating tool as Parent Aware. So it was just serendipitous that the name Parent Aware was there, and when the national organization switched to Child Care Aware, we thought it made a nice pairing.
Okay, great. So Todd did type in his email address and contact, so thanks so much, Todd. Again, thank you all so much for joining us for this last hour. Feedback on these presentations is encouraged, and also follow up if you have direct questions with any of the presenters or any of your peers on the chat function. Our next one will be late September, and we hope you all have a wonderful rest of your week. Take care.
Thank you.
Thanks, Mark.